All right, so we are again diving into common and challenging residency interview questions. So we are able to answer questions properly and with confidence. All right, today's question will be, tell me about a mistake that you made in patient care and how did you go about rectifying that and fixing that? All right, this is an excellent question, but it is a bit of a tricky question, right? But this provides you an opportunity to actually demonstrate your ability to learn from your experiences. So you have to give a specific example where you made a mistake and how you addressed it and what did you learn from this experience. Now let's get to the sample answer. Okay, that is a good question. And I do recall a case when I was an internal medicine intern. I was taking care of a new admission. I was tasked to admit this patient because I was part of the admitting team. And this was a 72-year-old male. He was coming in with pneumonia. He, of course, had other medical issues, including cirrhosis, and he was on loads of medication. And he was on diuretics as well as on spironolactone among his medication. And I did the protocol. I went through the questions, going through the medication list, lab work, investigations, everything else. And we gave the initial antibiotics and everything else, right? So I did notice that the potassium level was a little high. It was 5.5. And I didn't overlook that. And I knew the patient was on spironolactone. I was thinking, yeah, it will get better and on its own. And by tomorrow, it should be all fine with all the treatment that we will be giving otherwise. And I didn't take the extra step to actually stop the spironolactone. Tomorrow, the next day, the potassium went up to 5.8 and the patient did receive spironolactone the next morning as well. And so yeah, that was a mistake. I noticed that in the morning before rounds, I rectified it. I stopped the spironolactone and I started treatment measures for the hyperkalemia. And I informed my senior resident as well as my attending that I had missed out and I should have stopped the spironolactone the day that I admitted the patient yesterday. And I informed them about the measures that I've taken to correct the potassium level. The good thing was that the patient was not harmed. There were no significant otherwise EKG findings, and I communicated this all during my presentation, realizing that that was a mistake that I had made and I should have not have made that mistake because medicine is all about going and looking at the details. And this experience taught me that it is highly important to not overlook anything or even seemingly minor lab values and deviations. And whether it's mild anemia, mild transaminitis, anything, you should never let it go and you should always investigate or try to figure out what the cause is. And I learned to approach each and every lab result or anything else or medication list with a more of a critical eye and to communicate my concerns. If there is an issue, if somebody else had an oversight or any other minor issue, we point it out and we get to the bottom of it and try to figure things out. So this is one mistake that I do recall making, and I've learned my lesson, and haven't had issues any further in this regard. Not only for minor lab values, this actually put me in the mindset and improved my ability to manage complex cases even more effectively, because now after that, and even before that, this was, I believe, a little bit of a laziness from my part, but I am much more focused when I'm dealing with difficult cases and complex cases, and looking at all the details and going system-wise with every single thing has helped me markedly over the past year or so since that incident. Thank you so much for asking this question. All right, so that was the answer. And in the comments, let me know if you have a question that you want me to answer. And yeah, let's talk about it in the comments area. And yeah, let's connect if needed. Thank you so much. I'm Dr. Umer Khan. Bye-bye. You need some more help looking to connect? Then I will have links in the description. And you can probably find my 25 questions and answers, a PDF. Gives you the questions and the answers, and you can practice on your own. If you need further help, you can check the link in the description as well. Possible sessions with small groups as well as possibly one-to-one. And if you want to become a member of my channel on YouTube, and we will be having live interview preparation sessions as well. consider becoming a member there as well. And of course, we'll chat over on Facebook as well. I will have all the links for all of my social handles in the description. Hopefully it helps. Thank you.